everybody, I am Thatnursingprof and welcome to my channel. In today's video, we'll be discussing the Rubin'S phases of maternal adaptation. So basically, Rubin has said that postpartum women will go through 3 phases of adaptation: taking in, taking hold, and letting go. So I wanted to make a quick little video on this, kind of describing each phase. So the first one is taking in. It starts right after delivery and can last up to 2 days. Now, each one of these phases is going to last at different lengths depending on the individual and, lots of different factors. Is this your first baby, or is this baby number 10? Do you have 1 baby, or do you have triplets? So lots of things are going to affect these phases, so there is no set time frame for these things, and that's okay. In this phase, mom is more passive and more dependent, so she needs a lot more of your help and the help of others around her. She's concerned with her own needs, things like pain, getting sleep, and then eating. Maybe she's been NPO for 3 days and now she can finally eat, right? So she's more concerned about herself in this phase. She talks about the birth. So either she has, visitors visiting her, or she's talking on the phone. She's kind of telling everybody about her birth experience. She lets others care for the baby. Now, I don't want it to seem like she's not interested in the baby, because she is. She's interested in the baby, but at this stage, she's like, I'm tired, I'm in pain, I just want to eat something. Dad can take care of the baby, or you, the nurse, can take care of the baby for a little bit. That's what usually happens in this phase. And because of that, this is not a great time for education, okay? When we talk about taking hold, that's a better time. So taking in is not a good phase to educate, because it's going to go in one ear and out the other. She's not ready to learn at this point, and that's okay. The second phase is the taking hold phase. The second phase is the taking hold phase. So in this phase, mom is ready to be more independent. She is interested in taking care of the baby, and then she's also concerned. So she's concerned about her ability to care for herself, to care for the baby. She's asking a lot of questions. She's worried, am I doing it right? Am I doing it wrong? What do you think, right? So this is actually a really good thing. This is a good phase to do a lot of education. So education for mom and taking care of herself, feeding the baby, infant safety, all the basics, okay? That's what's happening in this phase, in the taking hold phase. And this really depends. It can start just after a couple hours after delivery in some women, and then this phase can last for, several months. So obviously she's not going to be in the hospital talking to you, the nurse, for several months, but she'll be asking, her grandma or her mom or other people in her family for advice about how to take care of the baby. Our final phase is letting go. And in this phase, mom is at home. So this happens when they're outside of the hospital, so we don't actually see this. So what's happening is she's assuming her position in the home. She's making a little schedule for the baby. She gets to know the baby better. What cry does this mean? What cry does that mean? When do I feed the baby, change the baby, that kind of stuff. She's getting into a little routine at home. She's accepting her role as the mom. And in some women, the demands of motherhood can put her into a mild depression. So this is something she needs to look out for. This is the letting go phase. This is the final stage. And again, this is one that happens usually when they're already discharged home, so we don't see it as the nurse unless you're the clinic nurse watching her for follow-up appointments. So that's letting go. Those are the Rubin'S stages. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.